name is Marianne Boccalini, and I'm the President and CEO of Samaritan Healthcare and Hospice in Marlton, New Jersey, which is outside the United States city of Philadelphia. Samaritan was founded 32 years ago as a not-for-profit hospice to meet the needs in our community for those with serious progressive illness and grief. Our philosophy of care, though, in addition to our mission, really recognizes our unity of life, our connectedness with each other, with those we serve, our community, and our world. And so to honor that larger global commitment of service, we partnered with the Foundation for Hospices in Sub-Saharan Africa through our National Hospice and Palliative Care Organization, and we were fortunately partnered with Kawempe Home Care and Hospice. So on behalf of our staff and volunteers, I enthusiastically wish you well and congratulations on 5 years of beautiful service to your community in Kampala.
Greetings and happy 5th anniversary to all of our friends at Kawempe Home Care in Kampala, Uganda. I am here representing our committee that includes staff members and volunteers of Samaritan Healthcare and Hospice. Also joining us are many individuals and organizations from our local community who want to help us support the work of Kawempe Home Care. Through many conversations via Skype calls with Dr. Guma and his colleagues, we have decided to focus our efforts on 5 key areas: the sale of beads for education, providing staff development and educational programs for the staff at Kawempe, raising funds to purchase medication and supplies for hospice and palliative patients served by Kawempe, outreach to our local community to engage more people in the work that we can do and expand our support for Kawempe Home Care. And lastly, we are planning joint visits to and from Kawempe Home Care so that our staff and volunteers can see the need firsthand and help us plan to support Kawempe into the future.
I'm Sally Cizo, Manager of Volunteer Services at Samaritan, along with my co-worker Joan Gribb and Samaritan volunteer Peggy Morgan. We are so pleased and happy to be able to sell these beads for education that come from Kawempe Home Care. They're beautiful, we wear them all the time, and we've even turned my office into a bead boutique. So far, we have sold over $12,000 worth of beads. And these beads are for education so that the children of Kawempe will get an education.
Our next outreach, we're taking the beads on the road. This is what we call beads in a box. We've arranged all the beads for sale. People can take these to their church, communities, or sell them in their homes. And we're really excited about this because we know that these beautiful beads are going to be very popular.
And with my fellow volunteer, Sabrina Smith, we're reaching out to churches and community organizations to give them the opportunity to sell the beads in their communities.
Samaritan is opening a thrift store, and in that thrift store we'll be able to sell these beads to many other people who come in. So we are so excited, and we would all like to wish you
Happy anniversary!
I'm Joanne Anthony. I'm a clinical nurse manager at Samaritan. I manage a hospice team, and I'm also privileged to be the new chair of the Education Committee for Kawempe. Strategic doctors that will be our partners in those presentations for education, and that is our own Dr. Holler, and then we have Dr. Ho, who is an infectious diseases specialist.
Hi, I'm Marianne Holler. I'm a team physician for Samaritan Healthcare and Hospice in Marlton, New Jersey. And an interest of mine clinically and personally to participate in international medicine initiatives. And here in the United States, I've participated in the Appalachian program, and then internationally in Honduras and Guatemala. As a result of those efforts, I'm becoming involved and someday hoping to visit Uganda and the program at Kawempe.
Hi Sam, congratulations on your 5th year anniversary. For everyone who doesn't know me, I'm Cindy Ho. I'm an infectious disease doctor here in New Jersey. Our office is called Garden State Infectious Disease Associates. And I had the pleasure of being recruited by Dr. Marianne Holler to help with the educational needs of Kawempe. And essentially what I've been doing is to gather research articles and provide specific topics of need. For example, we posted a lecture on HIV and cancer onto our Garden State Infectious Diseases Associates website, and if you can see, it's fairly simple and in text format, and there are different hyperlinks such as to Kawempe Home Care, Samaritan Hospice, and then lastly the HIV and cancer video. And all this was done with relatively limited resources. And it's not very burdensome, but that's because in Uganda the bandwidth for internet access isn't that great, so we wanted to keep it nice and simple. And on that website we also have infectious disease links, tuberculosis links, for which I understand that they have been helpful to Sam for his research. So it's been our pleasure to coordinate the educational aspect. In fact, going forward we hope to do case conferences and talk about specific patients and how to manage them. So congratulations on the 5-year anniversary.
Hi, I'm Sherry Brake, social worker with Samaritan, here to tell you about a fun event that we had this past spring to raise money for Kawempe Home Care. We fundraised a bowling event that raised over $2,300 to help supply medicine and supplies for Kawempe. Our employees were able to purchase these fun paper bowling pins and personalize them for themselves. And that evening we had over 100 people come out to bowl. We had a great time. It was a lot of fun. And happy anniversary to all of you.
Many ways to support and partner our wonderful sister hospice, Kawempe Home Care. And now our team has just one thing left to say. Happy 5th